Hello, I am Raúl Jiménez Bellinga, maxillofacial surgeon, and I'm specialized in rhinoplasty and also in facial cosmetic surgery. Well, the topic today is rhinoplasty. What is a rhinoplasty? Rhinoplasty is a quite complex surgical procedure whose aim is basically to change or modify the size and shape of the nose. Now, regarding a feminization rhinoplasty, we have to take in consideration different issues here. The first one is the combination with the forehead reconstruction surgery and also the combination with the lip. This is quite interesting and quite important here because we can and we have to change and modify the angle in between the forehead and the nose, and also to change and modify the shape and the angle in between the upper lip and the rest of the nose as well. So, talking about feminization is just a matter of removing masculine features. So it means basically removing excess of bone. So when we talk about a feminization rhinoplasty, the main issue here, the main goal is just to remove basically those masculine features which are located basically here in the dorsum of the nose. So it means we have to deal with the dorsal hump deformity. Quite often as well, we have to narrow the nasal bones as well, and also we have to work quite strongly in the tip of the nose, because here, regarding masculine features, the tip is much more, let's say, heavier and bulky rather than thin, which is much more feminine. So one of the main issues here in feminization rhinoplasty consists as well in making a reduction of the projection of the tip as well. Now let's talk about the technique itself. Well, there are different techniques in rhinoplasty. We can divide, or we can, let's say, choose in two different procedures. The one which is called closed approach rhinoplasty or external approach rhinoplasty. We prefer and we like to use the external approach rhinoplasty because it's much more easy to create a stronger structure to avoid any kind of collapse or problems by breathing or difficulties in function in a mid and long term. So it means in every feminization rhinoplasty, we like to use the external and structured approach. So it means we have to make some reconstruction in the inner part of the nose using your own cartilage. So it means we have to reinforce certain areas. A rhinoplasty is not a matter of just removing excess of cartilage or excess of bone. It's much more a matter of sculpting the nose and also making some reinforcement there with your own cartilage to avoid any kind of problems in a long term. Nowadays, I've introduced the use of the ultrasound technology in my rhinoplasty. So it means in every rhinoplasty nowadays, I use the piezo surgery device. Ultrasound is a very nice technology because we can cut the bone and we can save or modify the volume of the bone without damaging the soft tissue. So it means we cannot damage the skin or the muscles, and that helps a lot for the patient for the recovery time, because then we can decrease the swelling and the bruising as well. Well, who is a good candidate for a rhinoplasty, or am I a good candidate for a rhinoplasty? This is a very often question, very frequent question. And the best answer here is the best candidate for a rhinoplasty is the patient who has a very realistic expectations, and this is very important. One of the main issues in a rhinoplasty is the skin quality. Why? Because if the patient has a quite thick skin, then the degree of reduction or refinement we can get, mainly here in the tip of the nose, is much more limited. It means if a patient has a thinner skin or a much more delicate skin, then the degree of reduction, refinement, and also feminization is much easier. So that's the reason sometimes in some patients with a very big and bulky nose, we cannot get a very refined and a small nose just because of the quality of the skin. With a rhinoplasty, we can modify the cartilage and we can modify the shape and the size of the bones, but we cannot change the skin quality. So it means if you have a very thick skin, the degree of refinement is less pronounced than patients with a quite, let's say, thin skin. What about the recovery time? Okay, many people think after a rhinoplasty they will experience a very strong pain, and this is not true. Okay, after surgery in the nose, you will experience swelling, quite possible as well some bruising around the eyes, some difficulties by breathing. Okay, because of the edema and the swelling you have inside your nose, but not real pain. Okay. After 1 week, we will remove the little cast you have on top of the nose, and the day after the surgery, the morning after the surgery, we remove little nose packs you have inside, and then you can breathe much better. Regarding the bruising, it lasts around 2 to 3 weeks. So in some patients it lasts a bit longer, but usually after 2 to 3 weeks all the bruise has disappeared. What about the final result? Well, this is also a very typical question. To get the final result in a rhinoplasty and also in a feminization rhinoplasty, you have to wait a long time. How much? We like to say up to 1 year. It doesn't mean during 1 year your nose will be very, very swollen. Thanks God, it's not like that. The maximum swelling will come 2 days after the surgery, and from the 3rd day on, the swelling will start to decrease. Also, it's very important to understand the first months, 2 to 3 months, you will experience a lot of asymmetry in the nose. Why? Because the decrease of the swelling is not symmetric. Sometimes one side comes a bit lower than the other side, and you may feel your tip is a bit asymmetric. Maybe it goes a little bit to the right, 2 weeks later it goes to the left, one nostril is much bigger than the other one, and this is pretty common. Why? Because, as I told, asymmetry is very, very frequent because of the swelling, and the swelling stays longer here in the tip of the nose. So that's the reason we have to wait a long time, up to 1 year, and sometimes even a bit longer, because of the quality of the skin. The thicker the skin is, the longer you have to wait. Facialteam is not only a surgical group. We strongly believe in research in the field of FFS, and recently we have published an article about feminization rhinoplasty in American Journal of Facial Plastic Surgery. In this article, we show our experience and also our working philosophy in feminization rhinoplasty. We have selected 200 consecutive patients which underwent feminization rhinoplasty, also some of them in combination with the forehead reconstruction and or a lip lift technique. It's also very important, we have developed a special technique regarding the combination of a lip lift with a rhinoplasty, using the same incision and the same approach for both techniques. We can get 3 different conclusions in our article. The first one is the nose plays a crucial role in FFS. The second one, we strongly advocate for an structured rhinoplasty. So it means we have to harvest pieces of your own cartilage to give a better support for a long-term result. And number 3, the combination with the forehead reconstruction surgery and also with the lip lift is a very nice complement for a rhinoplasty in feminization.